In British politics, there's this thing called a quango, which stands for Quasi-Autonomous Non-Governmental Organisation. And today, Keir Starmer, the British Prime Minister, announced that he was scrapping what he described as the biggest quango in the entire world, the independent organisation that manages the NHS in England. Now, it will be ministers who are directly in charge. What's the thinking behind this? We will discuss that on this episode of the BBC's daily news podcast, Newscast. Hello, it's Adam in the Newscast studio.
And it's Henry in Westminster.
And shortly we will be chatting to the Health Secretary, Wes Streeting, because the Prime Minister's speech today about reforming how government operates, which was billed as like, oh, we'll do some AI stuff, we'll make some savings here, actually had a big kind of surprise finish, which was the axing of NHS England, the independent body that basically runs the NHS in England on a day-to-day basis. That used to be the function of the Department of Health, but under the last Conservative government, that NHS England was created as a separate body. Henry, we'll talk about the NHS England thing in a minute, but just lay out kind of the groundwork for what Keir Starmer was doing today.
Well, he was picking up themes that actually were very big at the weekend when Pat McFadden, senior cabinet minister, was interviewed by our colleague Laura Kuenssberg on BBC One, and he was talking about reforming the civil service. And Keir Starmer talked a lot about that today, talked about how the state doesn't work. I mean, actually, if you remember, Keir Starmer got into a bit of trouble towards the back end of last year when he accused too many civil servants of being comfortable in
the tepid bath of managed decline.
Yeah, there was. I think warm was used at some other point. But anyway, he used that phrase, and a lot of civil servants got very annoyed. And so today, the Prime Minister was at pains to say, no. This is not about individual civil servants, to be clear. This is about the system in which they operate. And I have to confess, as a journalist who already knew before that speech began that I had to file the lead Radio Bulletins piece for the 1 o'clock bulletin on Radio 4, I was thinking, I have no idea what I'm going to file a bulletins piece on here. The Prime Minister hasn't said anything new or interesting. And then, bam, out of nowhere came the NHS England announcement. And I think it is undeniably one of the most significant things that this government has done since it took office last July.
And why would you say it's so significant? I mean, NHS England isn't exactly like a household name. It's not like abolishing like the Bank of England.
No, and I think a lot of people might reasonably think, by the way, or at least before they'd read about it and thought about it, that the Prime Minister's abolishing the NHS in England. We should just be clear, the Prime Minister is not abolishing the NHS.
That would be a strange thing for a Labour government to do.
Indeed. Well, although some people would say that quite a lot of things, I mean, not to that degree, but quite a lot of the rhetoric of the Prime Minister today is quite un-Labour and almost certainly quite un-Keir Starmer, at least as he was when he was the sort of soft left leadership candidate in 2021.
Well, Chris Mason's been comparing him to Liz Truss today.
Well, there is definitely a critique that Keir Starmer now subscribes to and that various Conservative prime ministers and ministers alighted on eventually, that the lines of accountability in the state are just completely broken. Now, Keir Starmer and Wes Streeting will say, I think with some justification, they are actually doing something about it. And this is a big way to do something about it because NHS England is not just another body, or it's not just a sort of letterhead for the officials who work there. It runs, albeit in a complicated fashion, it runs the health service as experienced by people in England. And obviously we know that one of the big things which determines the fate of a government, good or bad, is voters' experience or their family members' experience or what they hear of their friends' experience of the health service.
Right, let's hear Keir Starmer's announcement in the speech, which came right at the end of his speech today.
So today I can announce we're going to cut bureaucracy across the state, focus government on the priorities of working people, shift money to the front line. So I'm bringing management of the NHS back into democratic control by abolishing the arm's-length body NHS England. That will put the NHS back at the heart of government where it belongs.
And so that's what, 15,300 staff, well, losing their jobs or maybe having their jobs moved to the Department of Health and Social Care.
Well, we got a bit of clarity on how this is going to work from Wes Streeting in the House of Commons, and I'm sure you'll get more from him in a bit. So across the two, mostly in NHS England, but also in the Department for Health, there's about 19,000 employees, and Wes Streeting said that overall he wants a 50% reduction in headcount, or to put it another way, half of them are going to lose their jobs. So that is significant. That makes clear that this is not just taking the officials of NHS England and folding them and the work they do into the Department for Health, but giving them a new email address. It is cutting out a lot of people who currently work for the government and no longer will work for the government. And that's very significant. It speaks to one of the arguments that Keir Starmer and then Wes Streeting have made for this change, which is that there is just crazy amounts of duplication in the system. I should say, by the way, I'm slightly kicking myself. I think I should have worked out that this was coming, because over the past few weeks, there's been drip, drip, drip of stories that actually, now, in light of this announcement, make a lot of sense. I.e., you had the
CEO resigning.
Exactly.
Amanda Pritchard.
And a few days ago, practically all of the senior leadership team who'd been working under her resigned. So it was clear that
people
something
like Stephen
was up.
Powis, who we got to know through the COVID press
Yeah,
conferences.
that one seems to have been sort of more long planned, but there were other people who we didn't get to know through the COVID press conferences, but were very important, who all resigned. And by the way, that's kind of the point here, isn't it? Is there, beyond Stephen Powis, who, due to exceptional circumstances, we did get to know, and to an extent Amanda Pritchard and so on, there are a lot of people who were extremely senior in the running of the NHS who even you and I, Adam, didn't know the names of, didn't know the faces of.
Even you and I.
Well, no, but and we're nerds, and we're paid to be across this stuff. But actually, that gets to the accountability argument here, which is another argument that Keir Starmer kind of made, and I think is definitely part of this, which is if, as it is, the health service is one of the most important determinants of how people vote, does it not make sense, the argument goes, for ministers to have oversight of what is actually happening, for the line of accountability to run clearly from the vote at the ballot box to what government ministers are then in charge of the health service and what they do and don't do. And that really interests me as an argument. It's an almost philosophical argument, but it is one that Keir Starmer gestured at today, because if that is what argument has persuaded the government on this issue, with what they're calling the world's largest quango that they're proudly boasting of having abolished, well, surely that argument is also going to hold for some slightly smaller quangos. So what's next? Are there other arm's length bodies that Keir Starmer is coming for? I mean,
well, for example, Rachel Reeves has let it be known that she's quite frustrated with lots of the regulators who do financial services and competition.
Yeah, she sacked one.
Yeah. So does she bring that into the Treasury, and the Treasury start regulating banks again?
I would not want right now to be working for an arm's length body or quango. I would be sitting quite uneasily in my seat. And I'm sorry, because probably some of our listeners do. And there obviously is a human element to these stories. I don't want to be flippant about it at all. But I do think it's quite an interesting... I mean, last week, Adam, I know you did a podcast about the Sentencing Council. This row that's going on between Shabana Mahmood, the Justice Secretary, and a previously relatively obscure body which gives guidance, binding guidance to judges on the ways in which they sentence people. And
a row which escalated this week because the Sentencing Council fired back, telling Shabana Mahmood to take her hands off.
Right. But if you were the Sentencing Council right now, and in fact, literally right now, the chair of the Sentencing Council is having that sort of showdown meeting with Shabana Mahmood, I think you would look at what Keir Starmer has done to NHS England and think, oh, OK, the threat that Shabana Mahmood has made to review the powers of the Sentencing Council and potentially abolish it, that's not an empty threat. That is something that this government might be willing to do.
But then at the same time, Labour have created something like 19 new quangos or arm length bodies or advisory bodies. And then think about health. The big decision about what to do about social care has been outsourced to somebody who's not in government. It's Baroness Casey's doing an independent review.
Indeed.
That's power going in the other direction. Although I suppose ultimately, he'll say this in a minute, won't he? He'll say he'll make the decision. It's just actually advice he's receiving from an independent body.
But I think there's a question about how much of this, and I think the answer is a lot, is about reflecting the experience of government ministers in their first few months in office. I think, and we've talked about this before, a lot of ministers have been really taken aback by the ways in which the state works or doesn't work. as it happens, in their view.
I noticed, though, in Starmer's speech today, he used a couple of numbers, and I'm always a little bit skeptical of these numbers, because he was talking about AI and efficiencies in government could save something like £46 billion. He didn't say where that number was from or over how long, and obviously it includes loads and loads of assumptions. And then on the thing about cutting the cost of regulation to business, he's got this target of reducing the cost by 25%. But it's what costs is he actually talking about, and just how realistic are these things that you can sort of bank as savings, as it were?
Yeah, it's a very good question. And the waters are slightly muddied when it becomes about savings as well, because that raises the question of, are you doing this because you want to, i.e. you think philosophically it's the right thing to do, or are you doing this because you have to?
Yeah, because there's no money left.
i.e. there's no money left and the Office for Budget Responsibility is about to give you a telling off. And that section of the speech, I think I was less clear on what Keir Starmer's answer to that question would be.
Also, just a last point before we then wheel in the Health Secretary to sit in the same seat as you. It was interesting seeing Keir Starmer doing domestic politics again. He's sort of been he's been on the international stage for a couple of weeks.
Yeah, and at the start of the speech, wasn't it noticeable how Keir Starmer didn't shy away from that? He acknowledged that and tried to begin to make an argument about why the international stuff is really important for the domestic. He kept saying things like, in these uncertain times, if we don't stand by Ukraine, then this. I think he had a phrase about security abroad, meaning security at home. And I think that is an early recognition, and we'll see a lot more of this, an early recognition that it's all very well for the Prime Minister to get good reviews for his statesmanship abroad, and he is getting those good reviews. But domestic matters are what determines how people, or many people, think the government is doing. And he knows, and his team certainly know, that he will need to tell as well as show when it comes to why that is all important and why he's spending so much of his time abroad.
Although it now feels like we've got something like 7 missions for the nation. So we've got the original 5 from the manifesto. Then we've got to rearm to promote security around the world. Oh, and by the way, we're going to rewire the state so that it's more accountable and more efficient. So I think we're now up to 7.
I think if you were getting that duplication in an arm's length body, Wes Streeting would abolish it.
Yeah, he'd be axing it. Yeah, it just seems to me like every week there's now a new kind of defining purpose for Keir Starmer.
Yes, but I guess in the early months of this government, it wasn't really clear that there was any defining purpose at all. So they'd probably take too many defining purposes over none at all.
Right. Anything else you want to flag up before we wrap up?
Not particularly, to be honest.
Okay, fair
that was very comprehensive.
We covered a lot of ground. Henry, thank you very much.
Pleasure. Thank you, Adam.
Secretary of State, hello.
Hello.
Is it true you've just been interviewed by Paddy O'Connell because he's doing Newsnight tonight?
I have, and let me tell you, Adam, I am outraged.
Why?
He has just compared me to the Fat Controller. Now, I know I've put on a few pounds in the last 8 months. That's what this job, ironically, being the Health Secretary, has done to me. But to be fat-shamed like this on national television, I tell you, I'm never doing Newsnight again. And let me tell you, it's lucky he's not here. Otherwise, I would have boycotted Newscast.
Well, okay. Well, just to be clear,
being among my favourite podcasts.
Paddy is the weekend newscast. This is the weekday newscast.
Yeah, well,
so
anyway,
different vibes.
I'm boycotting the weekend now.
Is it hard to eat healthily then in your job? Because I imagine you're on the go all the time, and it's when you're on the go is when it's hard. That's when you eat crisps and stuff, isn't it?
Constantly, and I have given up alcohol, sweets, crisps, cakes, and biscuits for Lent.
Oh wow, that's quite an extensive list.
Yeah, it's necessary. It was both a spiritual and health intervention.
Do you know what I've given up for Lent?
What's that?
Non-essential trips to restaurants. It just sounds so rubbish after what you've just said.
That is pathetic. Have you given up your obviously I'm doing this down the line, so I can't see. Have you given up your terrible moustache for Lent?
No. That's staying. Anyway, right, on to business. So, abolishing NHS England, very bold thing. Even people like Jeremy Hunt are saying that it's a bold thing to do. Just explain in just really kind of bold, basic terms why that will make people's healthcare better.
So we have got 2 headquarters for the NHS at the moment. My department for Health and Social Care and NHS England's head office. Now, taken together, they have 19,000 people which is roughly twice the size of what it was back in 2010 when Labour was delivering the shortest waiting times and the highest patient satisfaction in history. Through no fault of the people who work there, there's a lot of waste, inefficiency, duplication, man-marking, and at its worst, it can sometimes lead to contradictory signals, instructions, or multiple diktats being fired into the vast system of the NHS. And so the reforms that the Prime Minister and I are setting out today will deliver better value for taxpayers, saving hundreds of millions of pounds a year, which will enable us to put hundreds of millions of pounds into frontline services to deliver better care for patients.
What was the kind of penny dropping moment for you when you were like, oh yeah, I've got to get rid of this quango?
Yeah, I was reflecting on it over Christmas because I actually came in...
Sounds like a fun Christmas holiday.
Instinctively, well, this is how we roll. But I came in, I sort of came in back in July, really instinctively not in favour of doing reorganisation. I just wanted to really focus on getting the system as it was, working more efficiently, more effectively. And the more I experienced this way of working, these two organisations, two different cultures, and I just thought this has got to change or we are not going to succeed. And
but was there a particular egregious example where you just thought this is ridiculous?
There's... At its worst, been some back and forth and litigation and relitigation of decisions, which is frustrating. But actually, what Amanda Pritchard, who's the outgoing chief executive, and I have done actually quite successfully in the last 8 months, is to try and build a one-team culture. And I think the Prime Minister and I concluded, and actually with Amanda, because I obviously spoke to her extensively about this as well, one team could do with one organisation, and that would deliver lots of savings we can put into the front line. And I think for the NHS as well, the liberation that will come with not just having a smaller centre, but more power, more resources, more control devolved to the front line, which would be, I think, the biggest devolution of power in the history of the NHS.
Well, no, it's interesting when you talk about that you didn't want to do a top-down reorganisation. There's always a quote, isn't there? I mean, you said at the Institute for Government Fringe event at the Labour Party conference in 2024 that this was the last thing you wanted to do. But I suppose actually, once you get confronted with new evidence, you might change your mind.
Yeah, and it's interesting actually the reaction today. I mean, not a single Conservative opposed the proposal. And actually, it was Jim Bethell, Lord Bethell, who's a former Conservative health minister, said, I really wish we'd had the guts to do this. And I think that's what a lot of Conservatives are saying, because they could see that Andrew Lansley's reorganisation was disastrous. This is the final nail in the coffin of that reorganisation. And I think it will lead to better outcomes for patients, better value for taxpayers, and an end to this fallacy that in a system this large, of this scale, one of the biggest public services in the world, you can solve everything through centralised command and control from Westminster and Whitehall. So that is the big thing we are going to change ultimately. It's my responsibility as Secretary of State to make sure the system is delivering safe and timely, good quality care for patients and good value for taxpayers' money. Ultimately, it's for frontline leaders to determine how those services are best designed and delivered.
But if that former minister, Lord Bethell, is saying this is a gutsy thing to do, I mean, if you're doing something gutsy, that means there's a potential for it to go wrong, or it could be controversial.
Well, I think that there are no end of people who are saying, well, you know, this is could this be a distraction? Is there going to be some upfront cost? What's going to happen?
Yes
Yeah, and look, there are change is always disruptive. There's no doubt about that. And that's why I'm putting in place a transformation team at NHS England, led by the new Chief Executive, Jim Mackey, who has got demonstrable experience of this kind of organisational turnaround and of delivering lower waiting lists and better productivity and better taxpayer value and financial control at the same time. So I've built the right team to do the job, and I'm actually really excited about what the coming months will look like. Bearing in mind, we have got waiting lists falling 5 months on the trot now. So I hope I'm not pretending there still isn't a mountain to climb. My goodness, there is a mountain to climb. But I hope that, you know, day by day, week by week, step by step, we are beginning to rebuild a bit of hope, confidence and trust that politicians are capable of delivering what they said they will. This is the change people voted for, and that's what we're delivering.
I mean, obviously you're there to represent the public, but I mean, public sector workers have always sort of felt like a bit of a home with the Labour Party. Do you feel sad that you are sacking and making redundant today thousands of hardworking public sector workers?
That has weighed heavily on me because I don't think that the criticisms I'm levelling of the setup and of the bloated bureaucracy that we see is in any way a reflection on the brilliant people who work in those organisations. Many of whom, by the way, I think having spoken to people in meetings and actually a bit more informally sometimes in the pub or through the submissions that people send to me with reform ideas, I think a lot of people who work in these organisations recognise what I'm talking about. But ultimately, as exciting as I think the future will be, and as proud as I hope we'll be able to be of the change we're making, I do recognise that for people who are losing their jobs in this process, however carefully and respectfully and fairly we treat them through the redundancy process, this is never an easy time. I am mindful of that. And I want to make sure we're treating people in the right way.
And just in the processology of this, why is it that, so 2 weeks ago, we got Amanda Pritchard announcing her resignation. You had that exchange of letters. You could have unveiled this then. Then there was lots of stuff in the papers that there was going to be big job cuts at NHS England. And then in a few weeks' time, you're meant to be announcing this 10-year plan for the NHS. But yet here today, kind of out of the blue, the Prime Minister at the very end of his speech announces this big change. Why is it not all a bit more kind of slick?
Well, it has been a well thought through process, and the process of Amanda announcing her departure alongside
Did she know
other
then
senior...
that this is what was going to happen?
Yes, this was a conversation. Right. We've been talking about the need for reform and change. And
so you waited until the Prime Minister wanted something really good to announce in his reform speech to announce this?
No, I don't think it's quite that cynical.
Okay.
I don't think it's quite that cynical.
just a theory.
I hope it now makes sense that when Amanda announced she was moving on, and I was very effusive in my praise of her, I'm sure there are people scratching their heads thinking like, well, this is one of those situations, isn't it, where he's given her the boot and he's just being nice about it to make her look good. Well, no, actually, I think as Amanda knew at the time and the public know now, the job is fundamentally changing. And the challenge for the chief executive is changing. And quite understandably, having been at the heart of NHS England for 6 years, Amanda said, look, and she's perfectly free to speak for herself, but Amanda said, look, I'm on board with what you're doing. I support your agenda, but it's time for someone else to do this job. And Amanda and Jim work incredibly well together and have done for many years. There's a lot of mutual respect and affection there as leaders of the NHS. And of course, it was really important. We've been sort of spelling out for staff in recent days at town halls the direction of travel. I don't think today will have come as an enormous surprise, even if it has landed as a shock in the news. I think this is the reform direction we've been setting out. So it is disruptive. And it is big change, but that's the change that people voted for.
And just to be very nerdy, do you need to pass legislation through Parliament? Because I remember as a baby political reporter, the Andrew Lansley reforms that created NHS England were a huge kind of time suck in Parliament. And I remember one day in the House of Lords, I think there was something like 1,000 amendments to the legislation. Like, this stuff is easy to say, but can sometimes be a bit harder to do. And
I'm happy to report that much of the organisational change that is needed to build one organisation doesn't require changes to the law. Okay. We will, of course, need to change the legal framework, and we will do that. And that's why I'm saying this is going to be a 2-year process. I've got to take that into account. But the actual integration of both organisations into one team, one organisation, and that can happen a hell of a lot more quickly.
And then just now that you're going to have extra responsibility for the NHS in England day to day, can you kind of reassure people listening that you will always do the right thing for kind of like the medium and long term, rather than, I don't know, if like the Daily Mails and the other newspapers are like demanding that you do something that might be short term good but long term bad? Can you guarantee that? Because that was the point of NHS England being created in the first place, was to sort of protect it from day to day politics.
Yeah, and I'm not sure that intention was ever kind of realised in reality, to be honest.
Yeah, but it's a tension you're now going to have to deal with.
Yeah, and look, I think I hope that people have begun to get the measure of me in the last 8 months, and the way that I'm leading the team. I'm not blown about by events, and I am not. Although I'm not immune to criticism, I do actually spend a lot of time listening to what people say and reflecting on whether criticisms are good and ones that I should reflect on, or whether they are unfounded or wrong criticism. So I do listen, but ultimately, you've got to make sure you're making decisions for the long term. And that is why when I halved the number of targets that we gave to the NHS to deliver, and I was accused of deprioritising things I really care about, like women's health or disabled people, I ploughed on. When people said, oh, you're going to have to, you were wrong to say that the NHS should stop using the winter crisis as an excuse to ask for more money, I said that is necessary to restore financial discipline, and I stuck to my word last winter, even as people were saying, give us more money. I'm sticking to a plan that will deliver better outcomes for patients and better value for taxpayers. I'm sure I'm going to get loads of criticism. It's lucky I've got a skin like a rhinoceros, as I said to Paddy when he was calling me the fat controller. But you in political leadership, you have to just accept no one's going to agree with you all of the time. You do have to have the humility to listen to other people's arguments, to reflect on whether you're doing the right thing. But ultimately, as well as listening, you do have to lead. That is the leadership the Prime Minister is showing for the government, and it is the leadership he demands of us.
Well, thanks for talking to us today. Before you go, though, did you see that the King has now got his own playlist that he published at the start of the week?
Yeah.
We're doing a Newscast rip-off version. So what would you like to add to the Newscast playlist, which will not be available as a CD in any record shops?
I mean, this is almost like a kind of dress rehearsal for Desert Island Discs, and if the producers are listening, I'm available.
Oh, you've not been on it yet, have you?
Honestly, that is a lifelong dream.
Okay, we'll see what we can do.
Don't Leave Me This Way by the Communards would definitely be up there, one of my favourite songs. You're All I Need to Get By Aretha Franklin.
And what's your luxury on the desert? Hang on, I'm not auditioning for that role, just to be clear.
What would my luxury be?
Let's do a bargain basement Desert Island Discs right
What
here.
would my luxury?
This week it's probably, or this month it's probably a packet of crisps.
A hot shower.
I'm not sure.
I mean, a packet of crisps. Not you as well. What is this?
That's a reference to your own Lent pledges. I was not in.
Okay.
I don't do comments on people's appearances. That's you and Paddy that do that.
Lent is a time for reflection and forgiveness and repentance. So, I'm feeling generous.
Okay. Well, thanks for being generous with your time today.
Nice to talk to you. Thanks for having me on.
And that's all for this episode of Newscast. Thanks to everyone who's been on it, and thanks to you too for watching. We'll be back with another one very soon. Bye-bye.